The class 1 antiarrhythmic drugs are sodium channel blockers, so through blocking the fast sodium channels that produce the rapid depolarization seen in phase 0 of the fast response action potential, they are able to reduce the rate and magnitude of depolarization. This decreases conduction velocity through the non-nodal tissues of the heart, that's the atrial and ventricular myocytes and the His-Purkinje conducting system. So, the faster a cell depolarizes, the more rapidly adjacent cells will become depolarized, and leads to a more rapid regeneration and transmission of action potentials between these cells. So by suppressing the rate of rise and magnitude of depolarization in these cells, we can interrupt this process to some degree and help to prevent any arrhythmias in the heart. So that's the basics of how the class 1 drugs work. They are further subdivided into classes 1A, B and C. This is partly determined by the degree to which they affect the upstroke of the action potential, and also partly determined by the degree to which they affect the action potential duration. So changing the action potential duration changes what we call the effective refractory period. The effective refractory period is the time in which a cell is refractory or insensitive to another impulse generation, so you can't get another action potential during this time. And this is essentially the entire time that the cell is depolarized for. So if you lengthen the action potential, you lengthen the effective refractory period and lengthen the amount of time that that cell cannot generate another action potential. This is an important concept when considering arrhythmias and will be touched on again later when we discuss the class 3 antiarrhythmic drugs. So class 1B, these drugs have a fairly weak sodium channel blockade, as they associate and dissociate very rapidly from the sodium channels. So they only affect the rate and magnitude of depolarization very slightly, and they also have a slight effect of reducing the action potential duration. An example of a drug in this class is lidocaine, which is typically used for treatment of ventricular tachycardias post-myocardial infarction. Class 1C drugs, they have the strongest sodium channel blockade, so they have a very slow rate of dissociation from the sodium channels, so they produce an almost constant level of blockade of the sodium channels, and so they have the most potent effect on the rate of depolarization of the cardiac myocytes. And they don't alter the action potential duration at all. An example of a drug in this class is flecainide, which is usually used for the treatment of supraventricular tachycardias and ventricular tachycardias, and may also be used for treatment of the Wolff-Parkinson-White syndrome. This is a re-entrant anomaly that can occur in the heart and will be discussed a bit more later on, again in the class 3 drugs video. And finally we have the class 1A drugs. These have a sort of moderate degree of sodium channel blockade, so they sit roughly halfway between class 1B and 1C, and they actually extend the duration of the action potential ever so slightly. An example of drug in this class is disopyramide, and they are quite generally used for the treatment of supraventricular tachycardias and ventricular tachycardias.